And most people don't move really well through here. They don't rotate very well. But, that's the topic here today, thoracic mobility. Most people make that up through the lumbar spine. The lumbar spine really only has, if we stack those segments together, about 10 to 12 degrees cumulatively of rotation. So if I'm facing front here, and these are my lumbar vertebrae, this is about 10 degrees of rotation. That's all there is. That's all that we have in the lumbar spine. We should be getting about 45 to 60 from the thoracic spine. So if we're closed here and we can't rotate through the thoracic spine, the burden falls down here. Lo and behold, most of the disc injuries are down here at L5-S1 and L4-L5. It's taking up movement. It's compensation for lack of mobility through here. So not only are there different structure, different function, what we want to promote is the ability to extend, oftentimes, our thoracic spine, but we really want to go after the rotation. And we'll look at that with our clients today, and we'll talk a little bit more about it as we move through our presentation. Function. There's a few different aspects to function. So if we look locally, we can look at form closure or articular function. I touched on that earlier when I talked about the facet joints articulating together. So we should have the joints fitting together and aligning properly, moving through all ranges of motion, flexion, extension, lateral flexion or side bending, as well as our rotation. These joints should stack up in alignment and articulate or move properly. We don't want to wear down the discs. We don't want to wear down ligaments or cartilage. We want to maintain integrity of the structure. There's also something called form closure. Form closure is more neuromyofascial in function. So we have this soft tissue complex in and around. So we have the local musculature, which we'll talk more about, as well as the global musculature. This can be a big picture issue throughout the kinetic chain or dialing all the way down here. But if the joints are lined up and they're moving correctly, we have to make sure that the tissue around them is providing the appropriate stress and support through there to maintain alignment as well as load transference. So that form closure is the length tension relationships of the muscles and the tissues around there. It's the tissue quality health that allows for extensibility and contractility of those tissues.